Welcome everyone to another episode of Orthopod. I am now visiting a colleague and friend from Hamburg, Germany, Mustafa Citak, who is the attending orthopedic surgeon at the Endo clinic Hamburg, a very, very large, high volume clinic. Currently functions also as the research director and fellowship director. Mustafa, welcome.
Thank you very much, Mohit, for the invitation. It's a great honor for me to do my second podcast, and I'm really excited for the next 15-20 minutes.
Okay, so let's chat briefly about a couple of things. And I think, for me personally, we read a lot about what's happening in Germany, and certainly Germany is not, they've had a significant number of cases relative to others in the world. So, like, what's happening with respect to life in Germany? Like, what is the current state of the situation?
Okay. As you said already, in Germany we have not so much cases like other countries, for example, Spain or Europe in Spain or Italy in Europe. The current number in Germany is around 125,000 cases, and the mortality rate is fortunately low. But if you compare with the last weeks, we have a increasing mortality rate. So we had a short discussion 2 weeks ago, I think. At this time, the mortality rate was 0.77. The current number is around 2.4%, so it's increasing. As you mentioned, I'm from Hamburg. Hamburg is the second biggest city in Germany, and the mortality rate here is especially lower, with 1.7%. We have around 4,000 cases in Hamburg and 67 patients deceased, so it's a number of 1.7. The one reason for this lower number is maybe that the average age of the population is in Hamburg younger, because it's the second biggest city, and it's more university city. We have more single and young people. That could be the reason. So how affects the life in Germany? Of course, like everywhere, the life has changed in the last few weeks or months. We do not have in Germany like a completely lockdown, not in Hamburg. So you can go out for walking, you can do your sports, but for example, you have to do, of course, 1.5 meter or 2 meter distance. So what is not allowed, if you go with more than 2 people, it's not allowed to meet more than 2 people. It's also not allowed to visit friends, but you can go for shopping. But to be honest, most of the shopping centers are closed. You can only buy food or something to drink. But personally, if I go outside, you can feel it every time. Usually if I'm going in the morning by car, I'm seeing less cars than usual. More people are using bicycles, because to avoid any contact to the people, and you can feel it everywhere. You see more people walking with mask and staying with distance, especially if you go for shopping. It's very strange situation sometimes.
So let me ask you this. I mean, this surely must be having an impact on the clinic itself then. If there's a complete change in terms of distancing and, no one moving, I presume, and I'm, maybe you can enlighten me as to what is the situation right now for the endo clinic in terms of just what's happening at the clinic level. So are surgeons significantly decreased in the activities? Are elective procedures still happening? Or if they are, how are they happening? What's kind of the...
Endo clinic, as you mentioned, is the largest arthroplasty high volume center in Europe, and we are doing usually elective surgeries. So
right.
Usually we are doing 45 cases, including spine and sports cases. But currently, since minimum 4 weeks, we have decreased the numbers. So we are not doing any more elective surgeries if you can postpone the surgeries for minimum 2 months.
Like what
Yes.
types of surgeries are urgent, I guess, when you're managing, let's say, hip and knee
Yeah,
arthritis?
for us, urgent means if you have a periprosthetic joint infection. So
Okay.
this is the urgent case. We have also emergency cases, like of course periprosthetic fractures, or if you have a dislocation of a hip.
Yeah.
And sometimes if you have a loosening, like a severe loosening, and you cannot postpone the case maybe 2-3 months later. So we are
Yeah.
also doing those cases. But in general, the number has decreased a lot. We are doing 10 to 12 cases a day maximum.
Okay. So it's almost like a 60% reduction, almost 2/3,
Yes,
65%.
yes,
Okay.
yes.
Wow. Okay. Got it. And then how is that impacted in terms of like sort of the way you organize all other activities? I know personally you're quite invested in research. So
Yes.
how is that like how has that changed? I mean, research is a
I
machine
mean,
that often requires face-to-face input. Have you been looking at virtual approaches, or what's been the approach there?
in Endo clinic, we had no cases with any positive patients.
Yeah.
The good thing is we started very, very early with the prevention. So in
Right.
our hospital, we are taking care of all patients with the distance. No handshakes are allowed since
Yeah.
6 weeks or more than 6 weeks.
Yeah.
So the patient or we are wearing mask, and especially in Hamburg, we have in March. This time it was in March. We have the ski holidays. So the most of the
Right.
people in Hamburg go to the skiing for March. So every
Yeah.
colleague or every patient who were at this place, we didn't operate, or we screened all the patients or the colleagues to avoid any positive patient, to have the patient in our hospital. But
Right.
my work has changed also because I was invited to many meetings, so I have to cancel all the meetings. And now I have because our hospital is like we are scheduling for every surgeon the surgeries. And this week I was scheduled for Istanbul, so I'm here. So I have less cases or almost no cases, so I can focus on research. So for me,
Right.
it's good because I can do research, and we are doing a lot of research, as you mentioned. And my free time, if I have free time, I'm focusing always on new research projects. We are also trying to do multi-center study about COVID-19 positive orthopedic trauma patients. So
Mhm.
we will start very soon to see the
Right.
outcome. Yeah.
Oh, that's very good. So when you look at how things are happening right now, so when you look at your situation, do you find yourself and your colleagues having a sense of when this is going to go back to what would be considered the pre-COVID era, which was full reinstatement of procedures? So is there any sort of timeline that's been given to you? The world always is questioning, when can we get back to the way things were?
Yeah, that's a very good question. Until now, nobody knows how long does it take, but we have to see every week, or we have to make new decisions every week, sometimes every day. But of course, it has changed, and we have to see how it works. Like right now, we have less surgeries, but I cannot tell you until now when we will start again with a normal day. It can happen maybe months, it can happen years. I have no idea. It depends
Right.
on the situation, and it depends also from the government. If the government allows us to operate,
Yeah.
then we can operate. But if the government says also it's not possible, we cannot do anything.
Got it. And then, so what has been the general uptake? So has virtual medicine become sort of the approach that you're taking at the endo clinic? So all these patients that are scheduled, are you now interacting with them virtually? Are you doing virtual follow-ups? What's happening with your virtual care movement?
No, we talked about the virtual follow-up or
Yeah.
visits. So we are not doing it now. We are only doing, for example, research meetings or other meetings virtually.
Right.
But we have less patients also in the outpatient clinic. So usually every surgeon has 25, sometimes 35 patients. So every surgeon has decreased the numbers, and we are not scheduling the patients so we have to see not every 15 minutes another patient. So we have a new scheduling system, but we are not doing virtual.
It hasn't been something that's been hugely valuable at this point, or at least hasn't made sense for you to do. Have you had any interactions? The big thing we've started seeing examples of is patients who are on a waiting list for, let's say, a primary hip or knee, have called back and said, I'm okay. I don't think I'm going to need one now. I don't have to. I don't need. I'm okay. I'm maximizing my non-operative treatments. I'm doing a bit more home physio or whatever the case may be. We've started seeing examples where patients on waiting lists have said, nope, it's okay. I think I'm okay. Have you seen any of that happening?
Yeah, we have, of course, we have a waiting list for the patients. As I mentioned before, we are not doing primary hips or primary knees. If there is no, for example, avascular necrosis, it's a hip. It's something like urgent. But if you have a normal osteoarthritis of the hip or of the knee, so we are not operating. We are saying the patient, so he can go to the waiting list. So we have postponed all the cases for a minimum 2 months later.
Right. But I guess the question is, in that environment, non-operative treatment becomes,
yeah, you are right. You're
much
right.
more important, right? So in that case, there are many patients with hip or knee arthritis who just don't maximize non-operative approaches. And I wonder, those who start using some of these non-operative approaches, are they saying, I'm good, I don't need surgery anymore, or I don't need it?
But you are absolutely right. But the problem is that the patients are not going to the doctors for the orthopedic surgeon outside. That's the biggest problem. I think the patients are a little bit afraid to go to like outpatient doctors to get a treatment for conservative treatment.
Yeah.
So that's the biggest problem, because my brother is also is a professor too, and he has a practice in Hamburg, and he has also less cases than usual. So
wow, okay, that's interesting. So you've thought about this. You've thought about this from the perspective of what's happening in Germany. You've thought about this from what's happening in the Endo clinic. And by the way, the Endo clinic sees how many joint patients a year? How many patients do you treat in a typical year? You said it's the largest, but how many is the volume?
We are doing around 7,000 arthroplasty cases a year.
Wow, that's a lot. Okay, so that's a massive change from where you were and where you are now.
Yep.
You're a thoughtful individual. You think about research, you think about clinical practice. What are the lessons you're learning from this whole experience, and how might those lessons be applied in the future?
That's a very very good question. We learned many things. I thought every time that as a arthroplasty surgeon, as an elective surgeon, I'm always safe. But now nobody expected this situation. Now we have less surgeries, and as I said before, we have, instead of 45 cases, only 10 to 12 cases. So we are thinking, and everybody wants a new situation. So hopefully the situation goes over. But if you look at the last pandemic, so usually it takes 2 years to get everything back to normal. So hopefully this time it will get earlier. Otherwise, 2 years is a long time. We have to see and find new ways, because if you operate only 10 to 12 cases a day, it's a financial catastrophe.
Yeah, I agreed, completely agreed. It's an interesting time, and I think, well, as you said, we don't know what the future is going to hold. But the one thing that I've learned from talking to so many people around the world has been that we all seem to be in it together. There isn't one group that somehow escaped this. We're all in it, and we're all trying to problem solve. And the idea of you collecting data and we collecting data, I think we'll have to come together. And I know you and I will be working on some really exciting projects, so I'm excited about our ability to work together. But, you know, just a huge thank you for taking a bit of time for you and for me, you know, to be able to chat with you and get insights has been wonderful. So thank you very much, Mustafa, for the time.
Yeah, thank you very much, Mohit, for the invitation. My regards to Canada.